Hey guys, Dr. David Lim, board certified laser dermatologist. Today we'll be talking about something which is, I guess, a trend nowadays, but it's been with us for the last decade and the Koreans have been using it. It's called the sheet, S-H-E-E-T, sheet, not the other sheet, sheet mask craze. And this is it, guys. I touched on it last week, but today we're going into more detail in regard to sheet mask or facial mask. You know what? I didn't realize this. I've been doing this for the last, realistically, the last 5 to 6 years. And I've been using my own customized sheet mask, which I actually get from overseas. So it comes in a packet and basically it comes in a preset mask like this. And all you do is you drop it into water or drop it into the formulation of your choice. And that formulation you can see later on. For what I've been using is called PRP, and lo and behold, a couple of seconds later, you get yourself a mask. So I've been using this for the last, like I said, 5 or 6 years without realizing that there is a continual trend which is increasing in regards to the, I guess, availability of these masks, which have been freely available in Korea and Japan for the last decade, but now they're hitting Australia. And like I said, lo and behold, you get yourself a mask. And these masks can be made up using different materials, and you can see later on how I actually implement this in what I call the PRP, or platelet-rich plasma mask. And this basically goes on like that, and it stays on for about half an hour. So, why are these masks so popular? A couple of reasons. Number one, they're easy to use, super easy to use, and I'll go through the basics about how to use them, the basic 101s. They're super affordable as well. They start from 99 cents, and in Australia they go all the way up to, $4 or $5 for any of these. And you have a variety to choose from, which means you can address just about any skin condition or skin concern. Everything from dry, dehydrated skin to sensitive skin to rosacea skin to acne-prone skin, to skin whitening. If you've got melasma or pigmentation or discoloration, you've got a mask for that as well. And you've got even golden masks, which you buy for a couple of $100 that probably do nothing much, but I haven't tested it yet. So look, seriously, there is a mask for all your skin types, and out there's probably at least 1,000 different varieties. So I'm not going to go through a review on 1,000 different masks. I'm going to teach you how to review them, what to look for, what ingredients that you look for to give you the effect. Now, one of the great things with this is that it gives you an immediate effect. So it gives you an immediate hydrating effect. So how do you use this? First of all, you got to pick a mask that suits your skin type. What you see on YouTube with people saying, hey, this mask really is great. I've used it for the last 7 days. It's changed my skin. Well, that's their skin. It's not yours. So they may actually have a mask which may have an irritant, for example, an alpha hydroxy acid or beta hydroxy acid, while your skin might actually need something which calms it down. So you may have a rosacea type skin and sensitive skin, and what you're looking for are things like anti-inflammatories. You don't want fragrance like we mentioned about, because we don't want to irritate your skin. We don't want things like sodium lauryl sulfate. We don't want things like parabens. So all of these should not be in your mask. One of the downsides is about reading this. I find it myself super difficult to decipher even the English bit. It's impossible for me to read the Korean bit, but the English bit is in such small fine print I have to wear my magnifying glasses. Probably because I'm getting old, but truthfully it's very, very hard to see. But the active ingredients, if you actually look at it, they're there. Okay, so if you've got inflammatory skin, you want to look for things like dimethicone, because that's an anti-inflammatory. You want to look for things like hyaluronic acid, right? Even though I keep saying HA belongs under your skin, not on your skin. This is actually calming for patients with rosacea. You want to look for some things which build up barrier function. So you're looking at things, something called ceramide, which actually builds up barrier function. So all of these active ingredients, that's what I'm teaching you to look for, okay? And if you've got pigmentation, you want to find a mask out there. Certainly a hyaluronic acid mask, will it make your pigmentation worse? The answer is no. It can even make your pigmentation better because of the fact that you can use this to enhance other active ingredients. So if you've got pigmentation, you want to look for certain products which contain things like, for example, low-dose hydroquinone, which can be sold legally in some countries. But you want to look for things like alpha hydroxy acids, for example, AHAs, right? And plant extracts, including soy extracts, as well as licorice, because plant extracts can actually decrease the amount of pigmentation produced by our melanocytes, which lie on the skin, as in epidermal layer, and it reduces the amount of activity of these melanocytes, which transfer the pigment to your skin. So these are what you're looking for the mask. Now, what are the disadvantages? If you get it wrong and you use a super hydrating mask, like a hyaluronic acid mask every day, and you've got acne prone skin, you may be using too much occlusion with the mask, and next thing you know, you break out in acne and you're blaming it on the mask. No, the mask's actually okay, you're just using it too often. So it's really about finding the right mask for you, and there's only one way to do that, and that's to actually try it out. Okay guys, like I said, the cheapest chips, you can pick them up for as little as 90 odd cents. And it's not trial and error, it's trial and calculated error, because I'm giving you the ingredients and what to look for. Now, how do you apply it? Super important. What you do is you go into the shower, you wash your face, use a gentle cleanser. As soon as you finish, you come out. The reason being is that these masks are designed for one thing, that's to prevent TEWL. We keep saying TEWL, trans-epidermal water loss. So as soon as you're out of the shower, give yourself a pat, and then straight away use your mask of choice, whatever that may be. Put it on your face, leave it on for half an hour. Do not leave it on overnight, especially for things like hyaluronic acid, because of the fact that it takes your water, instead of actually infusing or preventing water loss, if you let it dry out, it basically sucks all the moisture you have and then makes you more crinkly. So it can actually make it worse. So follow the instructions, 15 minutes to 30 minutes. Another great thing about this is because it increases your water within your actual epidermis, it can help you with your actives. So if you're using your vitamin A, B's and C's and you want to take it a step up, what do? You use a mask. Why do you do that? It's because you're actually increasing the water in your skin. Now, if you think about it logically, your vitamin A, B, C's, alpha hydroxy acids, they all work in your dermal layer or the lower parts of your epidermis. The upper bits of your skin are basically dead skin cells will get shed at 28 days anyway. So what do you want to do then? You want to use a mask, and the mask actually increases the water content in your face, and that is how the molecules get delivered. They go through this jigsaw, which are keratinocytes, and they have to go through that because it's conducted through water. So all your drug delivery systems are conducted through water. They don't go through the cell. They go in between the cell and down to your basement membrane. Hopefully, they go through the basement membrane and into your dermis, and that's where it makes its molecular action. Or if it's targeting the melanocytes, hit your melanocytes at the base of your epidermis. So by using this in the appropriate manner, you're increasing your actives. So instead of actually buying for example, a retinol or retinoic acid in a higher concentration, you use this to actually increase the delivery. And you can do this without abrading your skin, which means you have sensitive skin. This is a good trick. You use a mask to actually get away around skin sensitivities to deliver your actives in the area where it's needed. Okay guys, so look, those are the basics in regards to mask. Like I said, read the ingredients, figure out what works well for you. Incorporate, like everything else with your skin regime, incorporate it into your regime. Start slow, work up from there. You might want to use a mask once a week. To tell the truth, I use mine, look, I try to use mine once every week, but I just don't have time. And I'm a guy, I'm kind of lazy. So, plus I have lasers, so I'd rather laser my face than actually put a mask on. So, but seriously, in all seriousness, try to use yours once a week, incorporate it into your skincare regime and work up from there. So guys, I hope you like how these masks are used, because these are commercially available and I'll show you how I use my mask in regards to how I manufacture these for what's known as bespoke skincare. So in this setting, I use this. I've been using this to deliver the safest and most natural active ingredient out there, which is platelet-rich plasma. PRP is derived from your own blood. So basically, we take it out of your own system. It's your blood. We spin it, and it's been scientifically shown. So unlike these masks, which don't go through FDA, TGA, or CE approval, PRP has been shown in numerous articles and papers throughout the world to actually help recover. So you can see how I do it. Part of PRP is harvesting someone's own blood, so it can't get more natural than this. If you're talking about natural methods of, I guess, applying a mask, we're actually using your own immune system to actually activate cells. So in this situation, what we're doing is extracting the blood, and then we'll show you what we do next. This is basically use a centrifuge. The centrifuge actually separates the platelets from the red blood cells. And with the platelets, they contain growth factors, which makes wound healing a lot quicker. So the downtime following this procedure, instead of being 5 days, will only be 3 days. So guys, this is a centrifuge, and as the name suggests, it spins the blood down. So it's basically closed. Hang tight, Emma, I might get you to help me with this as I photograph that. And you can see it's actually starting to spin. So this spins for just around 9 minutes, and then what we get at the end will be platelets, because the blood cells actually separate from the platelets. So just as a diversion, this is what I'm using the mask for. It's basically to heal up the procedure of which I'm going to do, which is basically infinite RF microneedling together with CO2 fractional laser. And we're treating atrophic scars, but we're also treating tethered scars. So you can see the severity of the scarring of which I'm treating with this particular mask. So we can't hurry this procedure up. It's 5 minutes before the centrifuge finishes, but in the meantime, I'm going to start microneedling, so hang tight. So right now I'm using an energy-based microneedling device. It's called Infini. I have a preference for this compared to the intensive, acknowledging that the solenoid in the intensive is better, in other words more powerful. However, this machine itself is very powerful, and the great thing about it is it delivers insulated microneedles. So each shot delivers 49 needles, so about 50 needles. So imagine doing it 10 times, you get 500 channels. This is where I say the Infini mask or the PRP mask comes in, because the PRP actually gets to the area and gets infused into the channels of which we create. And in this case, they are 3mm channels. So yeah, you can see the, hang tight, I'm just focusing on the needles. Yeah, so that's the depth. So in every patient it's different. In every situation the parameters will be different. In her situation I'm using a high energy level, longer pulse duration. I'm combining this with both subcision and also low density CO2. So the reason behind the CO2, and that's to hit the epidermal component with creating a little bit of heat to release some cytokines, in other words growth factors, so that the scars actually remodel better. So in this area, on average, patients get approximately 3,000 to 4,000 channels, so little micro channels of which the PRP goes in. And you can see how I actually utilize the mask in this setting with the PRP. So just think about it logically. Now we've got these little channels which go from the top of the skin, which means the PRP or platelet-rich plasma can actually go into the dermal layer of the skin, and that is where the acne scars lie. So you can see the collateral damage from Infini is minimal because it actually spares the epidermis, and I was using a very high setting, so you can see, look, it's minimal damage. Now we're going to use some CO2, so I'm going to use a CO2 laser here. The setting of a CO2 I use is this. It's low density but very high power. So maximum power in my core but very low density. The reason behind that is that I do want some what's known as heat shock protein, or HSP, that's to be released into the scars. And that actually remodels collagen a lot better. So I'm using many different methods, not just one. And guys, with this, for you physicians who are doing this, just think about it logically. Histologically, you've got a plug of keratin or char with the CO2. And the important thing before putting the PRP, which I find very illogical when people do it, is that they put PRP on top of that with a plug. So what I do after this is, and I'll show you very shortly, is to wipe it off. So this is one of the keys to getting proper PRP into the skin, is to actually give it a wet wipe first and then give it a dry wipe, and put the PRP as soon as possible, because of the fact that we don't want coagulation of the blood, and we do want the char off the skin, so that the PRP can actually go into the skin and not on the skin or under the skin, is how it's usually delivered. So you can see this is what happens after the centrifuge. What we're looking at is PRP over here. This is red blood cells. So this is what we want. Yes, I know it does look like urine, but it is actually good growth factors, cytokines, and in all seriousness, full of platelets. So the ratio would vary. The sweet spot is around a dilution of around 1.4, 1.45. But this gives you an idea of the PRP we receive using the Regen Lab system, and there are many systems out there. So you can't get more natural than that. This is your own blood, so the patient's own blood, and we're just using the top portion, and we're injecting this on top of the skin. And in certain situations, I use this with the subcision technique to go what is known as over and under technique, of which I use to treat acne scarring. So that's PRP, guys. Guys, so here it is. This is my actual technique of doing what's known as a custom mask or face masking. And this is PRP. You can see how it actually expands this this piece of paper. And remember, you can't get more natural than this, and the active ingredients, you can't get better than this, because we are using your own blood. So obviously, if you lead a healthy life, have a healthy diet, gives every single chance that this mask is going to work. So this is saturated with PRP, and then we actually put the PRP on the patient. So hang tight, I'll show you how it's done. So look at how I deliver the PRP. The PRP is delivered on top. So remember, I'm working as quickly as possible. The char of the CO2 has been gone, has been wiped off. The micro needles are fresh. So I do this all within, realistically, within a minute to 2 minutes. I like a little bit of bleeding. And then this PRP gets rubbed on. So it's called PRP over. In this situation, I've subcised the area, so I don't want to do PRP under, otherwise I give too much swelling and I increase the risk of giving a blood clot or a hematoma. So this is PRP over. Now see what we're doing now. Now I'm actually putting the PRP and layering it on. So this is exactly the same as the Korean mask technique, except guess what we're using? We're using your own cytokines, your own growth factors, your own natural resources of which your skin's going to heal. And the reason why I like this, and I was looking back on my records even before this craze of masks, I've been doing this for nearly 5 years, and the good side about this, one thing I can say, it definitely improves healing times. Does it improve the actual outcomes? I have not done a split face double-blinded study, just due to the fact that it will not get ethics approval in Australia. But this actually accelerates healing time from the procedure which we've done, which is basically the CO2, the Infinity, in many of these other lasers, and it actually speeds up the healing to a point where it's predictable. So this patient, I know, will heal up within the next 3 days instead of taking 5 to 7 days to heal up with this procedure. So this is how I incorporate mask. In this case, yes, it's made in Korea, Korean skincare mask using your own autologous blood. So now with the mask, we secure this just using a stocking. And I tell all patients, do not visit a bank within the next 1 hour or walk into a convenience store or a petrol station because it's not a good look. So this stays on, much like the Korean skincare. I actually leave it on for about 45 minutes because we don't want this to dry out at all. And you can see how super saturated that is. That's transparent, that's full of PRP. So we cut little holes around the eyelid areas and the mouth area so they can talk, eat, breathe, see. So this is I guess a adaptation of the Korean skin mask or skin masking to a level of which specialists perform. Now the patient just chills out for half an hour, 45 minutes, takes this off, and then we use an emollient, something like QV intensive or moisturizer, grease for peace, and like I said, it really accelerates healing times. Guys, I hope you like that video on skincare, in this case how to use mask. This is how I use a mask. Obviously out there you can buy commercially all these types of masks. Find something that suits your skin type, your skin concerns. Like I said, there are hundreds of them out there, and this is actually a bespoke one because we're using the patient's own blood and we're using the platelets, so it's called PRP Mask. Guys, once again, hope you like that video. Please share, subscribe, comment, and I'll see you same time, same place next Saturday. Stay safe. Bye.